I want to express my gratitude to you for your commitment to keeping yourself and our community healthy. COVID-19 has had extreme impacts on our way of life, our economy, our work, our children's education, our social relationships, and our overall wellness, including mental health. We must thank those workers supporting our critical infrastructure, including city staff, who make it possible for most of the communities to stay safer at home. And of course, I give my heartfelt thanks to the healthcare workers and first responders who put themselves at risk every day to take care of us. I also want to express my deepest condolences for those who have lost loved ones to COVID-19. In a community of our size, this international pandemic has rapidly become personal, many of us with friends and family who have fallen ill. Among Pasadena residents, we are seeing a daily increase in the number of people with laboratory-confirmed COVID-19. This is partly from an increase in testing and also likely reflects an upward trend in actual cases. This is consistent with increases in LA County, the state, and the country. The number of Pasadena residents who have died from COVID-19 continues to climb as well. Thus far, mortality has been among individuals 49 years or older and related to work or residence in a long-term care facility or nursing home. However, we have seen laboratory-confirmed COVID-19 cases among Pasadenans in all age groups, including under 18. About half of cases have been among people age 60 and younger, and people of a wide range of ages have had illness severe enough to require hospitalization. This illness affects everyone, and with the increases in cases and deaths, we must all continue to stay home. 2 additional measures have been taken by the Pasadena Public Health Department, which layer on top of the most important practices we must continue: good hand hygiene and physical distancing. The first additional measure is that essential businesses, such as grocery stores and restaurants that are serving takeout, must now publicly post and implement social distancing protocols that require employees to wear a non-medical cloth face covering when they are interacting with other people and unable to maintain physical distancing. Customers are required to wear cloth face coverings while in the facility, and businesses are also required to take additional steps for customer spacing and disinfection of high-touch surfaces. Of note, this health officer order does not prohibit any individual or family living in the same household from engaging in healthy outdoor activities, such as walking, so long as everyone is able to maintain adequate physical distancing from others, 6 feet or more. The person exercising outdoors and maintaining physical distancing does not need to wear a face covering. The second additional measure is that long-term care facilities have received a legal order to meet the infection prevention and control practices as directed by public health, such as restricting visitors, requiring temperature and symptom screening of all employees prior to work, and canceling group activities that lead to increased risk of disease transmission. The health department is working with the state licensing agencies for these facilities and with the facilities themselves to protect this population that is particularly at risk for poor outcomes related to COVID-19. Some good news. Current analysis seems to indicate that your efforts to keep yourself healthy by staying home have made a difference in the number of people getting sick from COVID-19 and the number of people requiring hospitalization. We are currently maintaining a level that the healthcare system is able to treat, though there are still problems with limited availability of testing and personal protective equipment. However, analysis also shows that any lifting of stay-at-home measures at this time directly translates into increases in the number of people with COVID-19, which could overwhelm our healthcare system and likely cause worse health and economic impacts. We are actively working with other public health jurisdictions and state and federal agencies to look ahead to the coming months. The State Public Health Department, in coordination with local health departments, has developed an initial framework that describes what indicators can help us decide the next steps. Some of these indicators include greatly increased testing and contact tracing capability, improved ability to keep the most vulnerable population safe, and the development of effective therapies and vaccines. While it is currently too soon to lift the Safer at Home order, we are planning for the time in the future when we will be able to resume many of the activities that are necessary for a thriving community, recognizing that we may need to do so in a modified fashion. That time will be dependent on where we are in relation to those indicators I described. I wish you good health and strive to keep you informed with the latest updates.